Is your tremor Parkinsonian or essential tremor? Imagine noticing a shaking in your hand or voice that just won't go away. It can be confusing to figure out what kind of tremor you're experiencing. Understanding the differences between Parkinsonian tremors and essential tremors can help clarify what might be going on. First, consider when the tremor happens. Parkinsonian tremors usually occur when your muscles are relaxed and at rest. You might notice your hand shaking while you're sitting quietly or your limbs are not in use. These tremors often start on one side of the body and may spread to the other side over time. In contrast, essential tremors tend to happen during movement or when you are holding a posture. For example, you might see shaking when you are writing, holding a cup, or outstretching your arms. Next, look at the speed and strength of the tremor. Essential tremors are generally faster, with a higher frequency, meaning the shaking occurs more rapidly. Parkinsonian tremors tend to be slower but have a larger, more noticeable amplitude, making the shaking more pronounced even if it is less frequent. The body parts affected can also give clues. Parkinson's disease often starts with tremors in the hands or limbs but can also involve the chin or legs. Essential tremors usually affect the hands and head and often involve the voice as well. Importantly, essential tremors tend to affect both sides of the body early on, making the shaking symmetrical. Parkinsonian tremors usually begin on one side and gradually involve the other side as the disease progresses. Another key difference is the presence of other symptoms. Parkinson's disease is associated with additional motor issues such as muscle stiffness, slow movements, balance problems, and a characteristic stooped posture. It can also cause a masked facial expression, where facial movements are reduced. Essential tremor, on the other hand, typically does not include these other neurological signs. It is mainly a tremor disorder without significant impact on muscle tone or balance. Family history can also provide clues. Essential tremor often runs in families, suggesting a genetic component. Parkinson's disease is less commonly inherited and involves the loss of dopamine-producing cells in a part of the brain called the substantia nigra. Finally, a healthcare professional, especially a neurologist, will perform a detailed examination. They will observe the tremor at rest and during movement, check for other neurological signs, and review your medical history. This comprehensive evaluation helps determine whether the tremor is Parkinsonian or essential. Understanding these differences is vital because the two conditions have different causes, progression, and treatment options. If you or someone you know experiences a persistent tremor, it is important to seek medical advice. An accurate diagnosis can lead to better management and improved quality of life. Always consult a healthcare professional for personalized assessment and care.